Before we start with the session, I would offer my prayers to Lord Dhanvantari, who is not only a Lord for medicines, but a mother to all us, all the doctors. So, first I'll offer my prayers to Lord Dhanvantari and my gurus, of course. Shankham Chakram Jalaukam Dadatamrutagatam Charudorbhish Chaturabhi सूक्ष्म स्वच्छातिरुद्याम शुक परिविलसन मौलिमं भोजनेत्रं कालाम्भोदोज्ज्वलांगन कटितट विलसत् चारु पीतांबराढ्यं वंदे धन्वन्तरिं निखिल गदवन प्रौढदावाग्निनीलम प्रौढदावाग्निनीलम. Okay. So while proceeding towards Garbha Sanskaar session, Ayurveda explains that Ayurveda has a special branch for pregnancy related issues, which is known as Vrusha Shastra. So there is a in that Vajikaran branch, suprajanan is included. Now, suprajanan is comprises of two words, su and prajanan. So, prajanan is related to reproduction. So, suprajanan is a better way of reproducing our offsprings. So, suprajanan is a branch wherein pre-pregnancy or the preparation for conception and conceiving and post-conception, which deals with the post-conception health of the fetus and mother. So the suprajanan is a science which is related to the grooming of process of childbirth, right from preparing for conception and achieving a healthy child. Now, health in as per WHO and as per Ayurveda, not only restricts itself to physical health, but it includes physical, mental, emotional, social health. Okay, so suprajanan is all about this along with spiritual health. So while I go through, meet many couples and women who are eager to conceive and have a healthy baby, when I introduce them with the Garbha Sanskaar, or many of them have heard from their friends or relatives, the first common question which pops up into the mind is, what is Garbha Sanskaar? Another question is, okay, I'll go to it, but when should I start it? There are women who start with Garbha Sanskaar sessions during their pregnancy, during 4th, 5th month of the pregnancy. Some start in 3rd trimester, or those who are well aware, they start it right from the 1st month. But is it really limited to starting with once you get pregnant? The answer is no. We'll come back to it later. And the obvious question, is it really beneficial? So I would try to answer all these questions. So what is Garbha Sanskaar? Again, Garbha Sanskaar is made of two words, Garbha and Sanskar. Garbha is the fetus, that is the baby, and Sanskar is a process, or it is a practice or actions, any kind of actions which would bestow upon good virtues or positive values upon an individual. In this case, upon a fetus or the baby. So it is about connecting a bond between the mother or parents and the baby within the womb. It is about educating the baby right from the within. Okay. And Garbha Sanskaar is not only limited to after the woman is pregnant or after the conception, but it starts well before that. It starts at the time you start planning for the conception. So Garbha Sanskaar begins from the time you plan for conception. So why is it so? Because if you imagine, can you imagine a farmer sowing, or reaping a crop or sowing a crop with all the weeds in the field, with all the, unplowed soil? No, because otherwise the seed won't grow well and it won't turn into a good crop. Similarly, our body needs to be prepared to have a baby. And now, since in this generation, we don't see that we have any of our kids have 4-5 siblings, or 3-4 siblings at least. This generation loves to have is either a single child, or there are not more than 2 kids. So when you have limited children, we obviously expect or desire for a healthy, intelligent, smart child. And that is where Garbha Sanskaar comes into. So before we start with our session, I would like to introduce some terminologies in Ayurveda, which usually cannot be directly compared, have an alternate word in modern medicine. So, and I would be using these terminologies over and over again. So I would just give a glimpse of these terminologies. So first of all, our body constitutes of 3 doshas: Vata, Pitta, and Kapha dosha. So Vata dosha is responsible for the movement, any kind of the movement in the body, for development, for any kind of expansion in the body, or regressions of mobility. Pitta dosha is responsible, it is a hot in potency, heat in nature, and it is responsible of any kind of metabolism in the body, any kind of conversion in the body. And Kapha dosha is cold by nature, cold in potency, and it gives strength and stability in the body. Then we have dhatus, but among that, what we will focus on is Shukra dhatu, which is responsible for progeny or reproduction. Mausa dhatu is muscle tissue, and Rasa dhatu is a lymph tissue, or a tissue which provides nourishment. And Oj is obviously the purest form of all the dhatus. There are certain terminologies like Beej means the seed. Literally, it means seed. But in pregnancy, it relates to sperm and ovum. Shuddhi is cleansing or detoxification of the body. Garbha is the fetus, and Garbhini is the woman who is conceived, or a pregnant woman. This pregnant woman or Garbhini enters into the Sutika phase, that is, after the labor, after the delivery, she is termed as Sutika. And Paricharya is the code of conduct which needs to be followed. Then there are terminologies like Mas, which means month, and Masanumasik is monthly or month-wise. Ahar is food, and Vihar is behavioral conduct. So let us go further and start with the topic. So basically, as I said, Garbha Sanskaar is about planning or starting with the process right from the time you plan for conception. So it is basically classified into 3 phases. One is Beej Shuddhi, second is Garbhini Paricharya, that is antenatal care, and Sutika Paricharya, that is postnatal care. So I have not limited my session to only antenatal care. The reason behind, so those who want to plan should be well aware about what actually it needs for the conception. And equally, Sutika Paricharya is very important, because Garbha Sanskaar is not only about the healthy child, but also about the healthy mother. So Garbha Sanskaar includes during pre-conception, it is Beej Sanskaar, Beej Shuddhi, diet for both the partners, and then concepts like Rutu, Kshetra, Ambu, Beej, which I will be discussing later. Then Garbhini Paricharya, that is antenatal care. It includes month-wise diet, trimester-wise exercise, some of the behavioral conducts, then communicating with the baby, and certain medicines which boost the health of the mother during pregnancy, and Garbha Sanskaar workshop. Similarly, Sutika Paricharya is all about diet, medicines involved in postnatal care, and the baby care. Okay. Okay. So now when you plan for the baby, there are certain things you need to know. So there are certain factors for before conception. As I mentioned before also, there are 3-4 essential factors when it comes to planning of conception. That is known as Rutu, Kshetra, Ambu, and Beej. So, as I said, imagine a field wherein you have to plant some crops. So you don't directly start planting any of the seed which you have in your hand. You consider certain factors, that is the climate suitable for the crop, then the soil which is required for the crop, and proper new minerals and nourishment, or what you call pesticides, manures required for the crops, and obviously a healthy seed. Similarly, in our body, it is Rutu. Rutu is the season or the conception period wherein you should plan. If you're planning for the conception, you should preferably choose these periods. Then is the Kshetra, where the child grows. It is obviously the womb or uterus. Ambu is water, that means nourishment. So whatever endometrium grows inside the uterus is obviously, it should be healthy and should be well grown to, to provide nourishment to the fetus in the initial days and help the fetus implant into the uterus. Then comes the Beej, that is the seeds. In humans, it is obviously the ovum and the sperm. Both these, this ovum and sperm should be healthy or should be in the purest form for the healthy child to conceive, for the conception of the healthy child. So let us know what could be the problems which hinders the conception. So what could affect this conception factors? See, we see many couples, they plan for conception and then finally they get frustrated or irritated with the delicious schedule. They have a healthy intercourse but still they are not able to conceive. And then the problem starts arising, there starts frustration. So sometimes there may be a simple thing that you are not trying on proper days, or you are not following a proper schedule, and that is the reason for not conceiving. So if you only could correct these things, it is easy for the conception. So first of all, Rutu. As I said, Rutu is this time. So time zone with respect to what? With respect to ovulation. So if the couple tries to have contact during the late days of the ovulation, that is on after 20th or 25th day, it is difficult to conceive. Similarly, if it has been tried in the very early days, like 4th, 5th or 6th day, it is a bit difficult to conceive. So you should actually follow the ovulation period, which usually is seen between 10th day to 18th day, 10 to 28th day. We generally ask for alternate day intercourse or regular intercourse. Then again, a season, Ritu as in season, if the climate is very hot, very cold, then it can be a problem for conception. Again, Ritu means also is related with an age. If the partners are above 40 or above 35 and with a hectic schedule, they may have problems for conception. So all these factors need to be considered when it is about Ritu. And lastly, the ovulation, delayed ovulations, or if you have PCOD problems or irregular periods, then again, that is a problem for conception. Kshetra. In Kshetra, that is when you are talking about the uterus, there may be some anatomical defects like a septate uterus, or there may be some physiological problems like irregular formation of endometrium or tubal blocks, endometriosis, or there can be some kind of infections which may affect the conception. Then ambu or nourishment. If the female who is trying to conceive is weak or has an inadequate nutrition, or is overexerted due to any reason, due to her job, family course, or any pressures, emotional instability, then there are chances that she may not conceive, or even if she conceives, there are chances of miscarriage. Then comes the Beej. As I said, Beej is the sperm and ovum. So when you are planning, you should be have a healthy sperm count in case of males. So, or the sperm should be devoid of any abnormality. The motility should be good. This is when it comes to male patients. And in females, it is obviously there should be no hormonal imbalance or ovulation defects. All these factors affect conception. So what we do is we initially ask the patient, ask the couple to go for Beej Shuddhi. Both of them should go for Beej Shuddhi. Now Shuddhi is, as I told, it is about cleansing or detoxification. So with our hectic schedules, our deranged eating patterns, eating meal timings, it is obvious that our body gets accumulated with toxins, with the excess of doshas, which can apparently affect the beej or the sperm and ovum quality. So to have the perfect or healthy sperm and ovum, we need to undergo certain therapies, which is known as Beej Shuddhi. And this we can achieve by Panchakarma procedures like Vaman, Virechan, and Basti. So this helps to detoxify your body, cleanse your body, and as well the sperm and ovum. So first of all, we find out the factor which has the problem, and then we treat it. If there are no issues with any of the four factors, then we can directly go for Beej Shuddhi. Once the Beej Shuddhi is done, the ovum and sperm are in purest form, then we go for Rasayan and Vajikar treatments. It is not actually about treatment. It can be achieved with a good diet and regular exercises. So these are the medicines which enhance the quality of sperm and ovum. I'll be discussing about it later on. Along with that, to improve the acceptability of the uterus for fetal implantation, we undergo regular local treatments like Yoni Pichu, Uttar Basti, and Dhawan. So Yoni Pichu and Uttar Basti and Dhawan are simple procedures which are not time consuming and can be easily done at your nearby clinic. Then, as I mentioned, dietary guidance, yoga, meditation, and probable days of conception should be selected. So these are the treatments for Beej Shuddhi, Vaman, Virechan, and Basti. And the local treatments include Uttar Basti, Yoni Dhawan, and Yoni Pichu. And as I mentioned, Rasayan and Vajikar medicines along with diet. So these was about Beej Shuddhi. Now, after Beej Shuddhi and Rasayan Vajikar, along with Rasayan Vajikar medicines, we advise patients to follow a certain diet. If you see male partners, or a male is more likely to be cold in potency, that is, we say Soma Tattva is in excess in male patients, male partner, which also reflects in sperm, that is, sperm is cold in nature, and to maintain the quality of sperm, we also need to maintain this cold nature. Similarly, a female patient or female partner is a bit goes more towards hot tendency, or she has more of hot property, and also the ovum is hot in nature. So we need to have certain different food types in both of them. So the common thing is ghee, milk should be taken by both of them. There should be balanced diet. Meals should be on time, and avoid excess tea, caffeine, smoking, or alcohol consumption. Then, especially for males, we ask them to have porridges or kheer made with milk, sugar, ghee. We ask them to have cashews, because cashews really help with the sperm motility and sperm, penetration in the ovum. Wheat boosts Shukra Dhatu, that is the reproductive tissue, and that is the reason we recommend males to have more of wheat or products made with wheat. Then in females, similarly, you can go for urad dal, sesame seeds, or the sesame oil, and fish. One thing is common that both of them should be having foods with seeds or seeded fruits. So you can have fruits like figs. You can have black currants, which seeded black currants, pomegranates, which are rich in seeds and which also boosts the health of the sperms and ovum, which are also seeds in human. Okay, so shall we move further? Okay. Then, after completing with the preconception rituals, let us move towards antenatal care. So, I would like to ask if anybody is those who are pregnant or conceived, have already conceived, are you planning to, or are you already following certain things for the well-being of the baby? Anyone? Okay. So, what I have seen with my patients is many of them try to have a bunch on a good diet, or some of them start with exercise, some of them start with prayers or spiritual being, or some of them, many of them start with reading books. So, Garbha Sanskaar is all about this. So now when you start with Garbha Sanskaar, what is the most important factor for healthy mother, for healthy pregnancy? This is a common thing. Many of our friends, our family members, or elderly members usually tend to guide us. So, like telling, we try to be happy. You don't have to get angry. You have to be in pleasant state of your mind. But is it really possible? Like only telling to be happy it doesn't help, because with the stressful job or other responsibilities and with the hormonal changes going on after conception, it is really difficult for a mother to try to stay happy. So to be happy, you need to follow certain guidelines, certain set of instructions, which will help you to relax and enjoy the pregnancy. Okay, so it is about physical and mental health of the mother. Only then the pregnancy can be healthy, the child can be healthy. So Garbha Sanskaar is about how to attain this healthy and a happy state. So there are certain things, there are 5 points about how to be fit during pregnancy. So these things, if taken care of, really helps you a lot during pregnancy and also postnatal period. So it is about wholesome diet, mental well-being of the mother, which is not only the mother's responsibility, but also the responsibility of her family members and friends. Then comes prenatal yoga, Ayurvedic medicines, which a little bit of them, and following Ayurvedic guidelines. So first of all, again, I'd like to tell that pregnancy or antenatal care is classified into 3 phases. It is first trimester, that is first 3 months or 12 weeks. Second trimester, that is from next 3 weeks, that's 4 to 6 months, that is 13 to 24 weeks. And third trimester begins after 24 weeks till the time of delivery or labor. So why am I explaining you these 3 trimesters? Because with these 3 trimesters, there occurs changes within the fetus inside the womb. And considering that in mind, we have to maintain our behavioral conduct, or we have to take care accordingly. So in first trimester, the baby is not fully developed. The baby is just a one group of cells which tries to implant into the endometrium or implant inside the uterus. So it is very important that the mother is also stable during these days or these weeks. That means the mother needs to be utmost careful. She should avoid heavy exertion or adventure, traveling or exertion. She should be careful with her acts, whatever she's doing, also with her diet. Then during the second trimester, the baby is stabilized and the physical and mental growth and development of the baby has already begun, and it keeps on continuing. By the end of the second trimester and by the 7th month, that is after 28 weeks, the baby is completely grown up. So all the organs, all the growth of all the vital factors is already accomplished. Then why extra 2 months, or why extra 8 weeks? It is only because the baby needs to attain more stability with a nice weight, so the baby can be viable when it comes out of the mother's womb into the environment around herself. So these 2 months are emphasized on weight gain and complete growth of the baby, and further on preparation of the labor. So we'll check one by one about all the things. Again here, these, as per Ayurveda, these are the certain factors which develop in the particular month, on which I would like to stress that during 4th month, the heart develops. Heart development is emphasized. 5th month stresses upon the development of muscle tissue, hair of the baby, and the mana, that is soul. 6th month is about intellect, blood vessels, skins, ligaments, and further on. And 8th month is a crucial month, whereas the OJ or the vitals of the body is unstable, which helps the baby to stabilize, which helps the baby to learn to live on its own without the support of mother, which he or she might be facing a week, 4 weeks later. So as I said, the wholesome diet is of utmost importance in antenatal care for the development of the development of the baby and health of the mother. So there are certain diets, certain dietary foods which form an integral part of the pregnancy diet. All these foods provide the essential nutrients necessary for the fetal growth and development and the mother's health. So mother's health in what? It meets the maternal nutrition requirement. It promotes the uterine growth, stretching of uterus, helps, provides nourishment to the fetus, and also takes care of mother's digestion, lactation, and hormonal balance. So whatever food the mother takes during the 9 months of pregnancy, the nutrition which is gained after the metabolism divides into 3 parts. One of the part goes towards the fetal nourishment, one part goes towards the breast development, and the third part goes to the fetal nourishment. Okay, so but the important thing is whenever the female gets pregnant, it has been observed that people keep her guiding that you should have enough food, you should drink 2 glasses of milk, you should go with coconut water, you should have lots of fruits, then you should also have dry fruits, you should also have other important dietary foods, and she ends up into hogging for the whole day, which leads to indigestion and improper nourishment of both the mother and baby. So it is very important to avoid overeating and frequent munching. Am I audible and is the screen visible?
Yes, Dr. Shweta.
So no, I had a pop-up, so I thought there's some issue.
Okay. No, it's just that the pop-up is from the questions we are getting from the audience. Okay, so we request to all the audience that we'll take all the questions post Dr. Shweta's lecture. So let her lecture complete and then we'll take all the questions.
Okay, so shall I continue? Yeah. Okay. So as per the trimester, we will the Ayurveda recommends certain inclusions of food during each month of pregnancy. So along with the along with the set of dietary foods which is mentioned, which is crucial and important, we'll have month-wise dietary inclusions as well. So when you ask Ayurveda what are the essential foods which needs to be taken in the pregnancy, first is the milk. Now milk is a complete diet. Anyone can survive completely on milk. If possible, you can go for A2 milk. When I say milk, I preferably consider cow's milk, or Ayurveda recommends cow's milk, as it is easy to digest. It is good for mental growth, it is good for brain development, and also doesn't have excess of fat content in it. So a pregnant woman should at least have 2 glasses of milk throughout the day. If at all there are issues like morning sickness or she has a nausea towards milk, then she can find an alternative, like she can knead the flour with milk or cooks rice in milk, or she can have some porridges, or if not, she can continue it in later month. Okay. If at all saffron is to be added in milk for a better skin texture, better color of the baby, it is always advised that you use a single strand of saffron in glass of warm milk. Okay, because saffron again is hot in potency, and we do not want any hot potency foods going into the body, or a spicy food, junk food, to be taken by the mother. Saffron is very healthy. It surely gives good texture and tone to the skin of the baby, but it is hot in potency, so it is always advised to have a single strand in a glass of warm milk, single or maximum 2 strands. Then is the ghee. Now, ghee is very essential part of pre-pregnancy, during pregnancy, and post-pregnancy. You cannot imagine healthy pregnancy without ghee. Again, when I mention ghee, I mean cow's ghee, and preferably A2 ghee. Okay, so you can add, start with 2 to 3 spoons of ghee in a day. You can include it, you can have ghee plain, or you can have it over your rice, in your porridges, or in your rotis, or in your breads, whatever. Then comes whole grains. Now, whole grains have all the essential nutrients, minerals in them. So usually wheat, rice, jowar, ragi is recommended, because all these are rich in calcium, carbohydrates, minerals. So these whole grains are recommended. You can make it into pancakes. You can have them as a roti or bread, or any porridge, or any favorite comfortable food items you can make out of these. Then only thing is, I don't recommend bajra, because again bajra has a tendency for constipation, and it is also hot in potency. Then we move on to dry fruits or fruits. So usually recommended dry fruits or fruits are dry figs, as it is seeded, dry dates or dates, because they are high in iron content. They maintain your hemoglobin levels. Also, they take care of your constipation issues, because generally I see women, when they start on with iron and calcium tablets, along with that they have a constipation problem. So instead of having a lot of medicines for constipation, if you munch on good healthy foods, you can take care of your hemoglobin levels, your iron and mineral levels, and also stay away from issues like constipation or nausea, vomiting. So you can have dry figs, you can have almonds, you can have black currants. Of course, black currants should be seeded ones and not the deseeded ones. I generally don't recommend having cashews or pistachios during pregnancy. Walnuts, if they are to be had, they should be soaked in milk or water, soak it overnight, and then you can have half a kernel of walnut. Because again, walnut, in spite of being good in high in omega fatty acids, and being rich in good for brains, it is hot in potency. So it is ideal to soak walnut in milk or water and then have it. Last thing is panchamrit. Now, this is a wonderful combination mentioned in Ayurveda. It has 5 things, likely as per the name. It is 5 and amrit. So it is equal to elixir. You can say during pregnancy, and it is very good for immunity. It is good for fetal growth. Even after, once the child is born, you can start with panchamrit after the child attains feeding age. So panchamrit basically has 5 things in it. It is milk, curd, sugar, honey, and ghee. So this is a combination of 5 things. If you're taking curd, honey, sugar, and ghee 1 teaspoon, then milk should be approximately 10 teaspoons. So you can mix this If possible, you can keep it in a silver container or a silver bowl and have 2 spoons of it on a regular basis. Along with this, you can also start with fresh butter. You can have buttermilk. I don't recommend having much of curds, but buttermilk is a good option. Curds can be had during daytimes if you crave for it and if you like it, but you should have it along with sugar or salt or amla powder or moong. Okay, then we'll now proceed towards month-wise diet. So this is what Ayurveda recommends, and this recommendation is on the basis that with each of the growing months, each of the upcoming months, there is a certain growth, there is certain factor or aspect in the fetal body which keeps on growing. So as I mentioned, first month, it is only a cluster of cells coming together. Second month, it starts taking shape. The third month, all the limbs, all the organs start appearing in a very minute form. Okay, all the indriyas, that is sensory organs, begin to develop in its very initial phase in the third month. Considering these, for the proper growth of the fetus and also proper nourishment of the baby, of the mother, these dietary inclusions are recommended in Ayurveda. So first month, it is advised to take 2 glasses of cow milk every day. So you can take the milk warm, normal temperature, or lukewarm. To this, you can flavor it with elaichi, that is cardamom, shatavari kalpa, or any combination of dry fruits. But I don't recommend it having with fruits. No fruit should be combined with milk, or milkshakes are not recommended. You can flavor it with dry ginger powder as well. Whatever you like, but no fruit shakes or fruits as such. You can add ghee to the milk as well. In second month, when the baby is taking shape, when to stabilize, to control the movements of Vat, usually sweet taste pacifies Vat. And so sweet herbs, which are dominant of sweet taste, like shatavari, bala, ashwagandha, bokshur, licorice, all these can be added to milk. So you can either medicate this milk with these herbs, or have certain powders or preparation of these herbs and have it along with milk. For example, shatavari kalpa is a preparation of shatavari decoction with sugar that you can simply add as a health drink in the milk and have it. Whereas you can medicate milk by adding these powders to the milk, boiling it, and also adding, so I'll help you with the process. You just have to take 1 cup of milk, add 1 cup of water to it, and add the powder, boil it, and reduce it to 1 cup of milk. This milk you can add sugar, crystal sugar, and have it. Okay. Then in the third month, it is important to have milk along with ghee and honey. Now bear in mind, honey and ghee should be never taken in equal proportion. So you can alter the proportion of honey as per your taste. Honey and ghee. Okay, sorry. Another important thing is, whenever you have honey, honey should never be consumed with hot products, hot foods, or should never be heated. It is not good for health. So while recommending honey, we advise you to have it with very lukewarm milk or normal temperature milk. Okay. Now we move on to second trimester. So in the fourth month, that is when heart is predominantly taking shape. Heart is an organ which is continuously in action. So, and anything which is continuously in motion has a danger of, has an harm of vitiated Vata or increased Vata. So to pacify it, we need to give it with certain lubricant foods. So fresh butter is a best solution for this. And so it is recommended to have fresh unsalted butter with crystal sugar. Crystal sugar is a rock sugar which you get, which is shapeless, of course. And this sugar you can consume anytime throughout the day, or you can include it in your meals. In 5th month, as I mentioned, muscle tissue is in the formation. What happens in the 5th month is usually the muscle tissue is being formed, and the nourishment from the muscle tissue of the mother also is engaged for the nourishment of the fetus. And in turn, the mother is usually seen weak, feels weak during 5th month. And so it is necessary for the proper nourishment to have ghee. In 6th month, this ghee should be medicated with either licorice or shatavari. You can get Yashti Siddha Gruta, that is licorice ghee, or Shatavari Gruta is easily available in market. And if it happens that you don't find this, if these ghees are not available, you can simply add this powders to the ghee and consume it. Okay. Now you have to continue with the same regime in the 7th month, same as 6th, that is ghee infused with sweet herb. 8th month is special, wherein, as I mentioned, the Oj Dhatu, which is a vital thing for the survival of this fetus and the mother, Oj is very essential, and it is unstable in this month. Just to make sure that the baby starts living independently without mother, because it is a nature's preparation for the labor, and once the baby is out of the mother's womb, it should be stable. So this is the thing, that the Oj is unstable during this month. And to boost this, Ayurveda recommends having sweet gruels made of rice. You can have gruel or kheers made of suji, wheat vermicelli, or even ragi sattu. Anything can be taken during this month. Any preparation, see, you have to make the preparations as per your taste. You should also start liking those foods. So make it as per your taste. And the last 9th month recommendation is not a dietary recommendation, but it is a therapy, not actually therapy, a procedure known as Anuvasan Basti. Now, Basti is the process in which we introduce or insert medicated oil or decoction into the body through anal route. Now, Anuvasan Basti is oil Basti, is a Basti with oil. So we generally use medicated oil or plain sesame oil and instill one Anuvasan Basti once a week. Now, what does this Basti do? This Basti helps to control Vat, regulate Vat functions, and helps the baby to take its head down position. So this helps the baby to engage easily in the cervical, engage the head of the baby during the labor, and facilitates easy labor and easy normal labor. So it is advisable to have Anuvasan Basti. After the diet, now the diet was a big part. Now after the diet, what we have to stress upon is mental well-being of the mother. So as I said, it is not easy for a mother to maintain herself, maintain her mental levels. Okay, so there are certain guidelines which she needs to follow, which includes meditation, spiritual practices, or following your hobbies, communicating with the baby, and practicing certain tips on a regular basis. So about meditation, or so you don't have to get overwhelmed with, oh, I have to meditate, so I have to spare some few hours for this. No, it is, you can keep it as simple as sitting at a place, closing your eyes, and just focusing on your breath. Just observe your breath. This helps to regulate your breathing, speed. Once your breathing speed is settled down, you tend to relax. And with a relaxed mind, you tend to focus on the things. And this, once you start, settle down with and relax yourself, then you can practice deep breathing. So I think there's a session for exercise and yoga after my session by Miss Kadambari ma'am, and I will let her go more into that details. I'll just introduce you with it. So meditation is it is a very simple thing. See, what happens is, why are we practicing all these things? only with an aim for easy labor. So believe me, each and every muscle, each and every organ of your body, part of your body, right from your facial muscles, your teeth, all of them are involved during labor for bearing down. So meditation is just preparation of it. Meditation improves your stamina, your breathing, it regulates your breathing, and it also improves your patience level. So when you're bearing down with that terrible pain in your mind, you can be able to maintain your patience, control your breathing, and engage all of your muscles very well for the labor. Okay. So meditation, now you can find many videos or many guided meditation audio clips on YouTube. You can follow them. There are also certain enhanced meditation pattern techniques like avartan dhyan, which we call, through which you go into inner environment of your body. You can feel your baby, you can talk to your baby, and that builds a bond with the baby. So you can, if you are at home, you can just start with regular focusing on your breath and regulating your breathing patterns. Okay. Then spiritual practices. Now these spiritual practices, I don't stress on any religious virtues or any casteism. It is totally up. You can look at towards, you can see to it as activity or practice just to bestow upon good virtues on your baby. As I mentioned, all the complete body is engaged by labor. Similarly, including spiritual practices like chanting mantra or reciting Omkar. What happens is when you start reciting mantra, any mantra you can take, whichever you like, depending if you follow Jesus Christ, if you follow Lord Krishna, or Shankar, or or Ganpati, any of the god in that matter, you can chant those mantras for well-being. Chanting mantras give positive vibes. Now, you already had a session with Chitra ma'am for mantra chanting, and I hope she has enlightened you with mantra knowledge. So what I generally recommend my patients is to chant Gayatri mantra and reciting Omkar. These are the best practices because chanting of these mantras energizes the pressure points on your body. And through these pressure points, it stimulates the pran or vayu in the baby and the mother and gives positive vibes. So again, then you can indulge into holy script, reading of holy scripts. Another simple practice which I recommend my patients, and it's really helpful, is lighting a lamp or diya of oil or ghee in the evening. If you please, you can do it in front of your puja room, or you can do it individually, no issues. And there's a particular bell in generally a Hindu family made of brass. Now it has a special resonant effect, which increases the positive aura and helps the baby and the mother. Okay, and keeps away from many infections because it is generally asked to do in the evening. Now, evening is a transition phase between day and night. So this is a period where mother, which is naturally weak due to pregnancy, can get infected through various things, like microorganisms. And to prevent this and have a positive attitude, she can practice this. Again, hobbies. You can indulge into any hobbies, whichever you like, whichever keeps you happy, whichever keeps you pleasant. Only thing is, if you avoid any adventurous thing or any strenuous activity when you are into your hobby. If you're reading, read inspirational, motivational, spiritual reads. And if you're reading, make sure you read aloud. So the vibes can reach to your baby. This is a wonderful thing when you communicate with your mom. And no doubt this not only pleases you, but also makes your baby feel comfortable in the womb. And I've heard, like, I have lot many experiences or reviews coming from my patients, wherein they tell me that there was a patient of mine who used to recite Hanuman Chalisa, Maruti Stotra during a pregnancy. She used to place her hand on the womb, on the belly, and recite Maruti Stotra every day. You won't believe, the baby really responds to the sound of the mother. It is so much connected with the mother through the cord that it can really feel the emotions, it can feel the mental state of the mother. As Ayurveda mentions, that all the indriyas are begin to develop in third month. And as for modern science, hearing sensation initiates at around 18 weeks. So your baby starts to feel, starts to listen to you. So I was telling about my patient. She used to recite Maruti Stotra, Hanuman Stotra, every day during a pregnancy. And after the postnatal period, after the childbirth, whenever the child used to cry, one day it used to take long to settle the child baby down. So one day what she did, she just started reciting Hanuman Stotra, Maruti Stotra, and the baby started calming down easily. So whenever the baby used to cry, for any particular reason, she started reciting Hanuman Stotra, and the baby used to respond to it very nicely and calm down. So there are incidences where baby can listen to you, baby can understand you. So what you can do is, whenever you have time, there's no time for this. Whenever you have time, you can sit down, place a hand on the belly, and speak aloud. You can talk to your baby, you can start a communication. How are you? Are you all okay? Or guide it, or you can just guide positive statements, or what you can say. You can just keep on saying positive statements, that you're all okay, you're going to be fine, I'm eager to meet you, I'm very happy to have you. Anything, whatever makes you comfortable, or whatever act you're doing, that you can name that baby, and you can start, I'm working, I'm cooking this for you, I'm adding ghee to your food, anything. And if you are practicing same thing during your meditation time, you can as well narrate a good story, any of the good experiences, positive experiences you had, or anything you would like to share with your baby, which would make you and your baby happy. You can do that. So it is a very simple thing. You don't have to get overwhelmed with the thing that how could I communicate? Is the baby really listening? No. You can just start with it. Start it right from today if you're pregnant. Okay. Then prenatal exercises, as I said, Kadambari ma'am will be taking it in detail. But one thing is sure, you don't have to practice strenuous exercises. The exercises should be light, but it should include all the stretches and muscles in your body. So it is better to have a proper guidance from a yoga teacher. So these exercises, it helps to relieve some small ailments which you have during pregnancy, that is stretches, some postures for back pain, or there is bloating during later trimester, like third trimester usually. There is bloating, or the women has digestive issues, constipation issues. Then these exercises surely helps to reduce these problems. So practice exercises on a daily basis. Then medicines. We have to understand that pregnancy is not a disease. It is a normal phase in a woman's life. And let us treat it as a normal phase. Why are we doing all these other things? Is just to take care of the mother and baby, and to give some good values to the pregnancy and to the baby. So medicines are needed if there are small issues, or if the mother lacks some kind of nourishment, nutrition levels. So you give folic acid tablets, you give iron tablets, calcium tablets. Otherwise, even if that is not given, you can add up a good healthy diet. That also helps. I don't I won't mention medicines here as if, because every individual is different, and it is not wise to advise a particular medicine in general. But one thing is, you can start with Shatavari Kalpa, and Ayurveda mentions some certain decoctions. As it mentions a month-wise diet, it also mentions month-wise decoctions to be taken. This is for proper nourishment of the baby. Because as I mentioned, each month there is a certain factor growing or developing in the womb. So for development of these factors, it tries to take maximum of the nourishment from the mother. So we just make sure that the stock with mother is sufficient. So to boost up that stock, we give these decoctions. So you don't have to make decoctions as well. There are wonderful tablets. These decoctions are compressed into tablets, and it is available in the market. That is known as Masanu Masik. So that is monthly tablets. So you get tablets for first month, second month, third month, fourth month, and so on. So you can just pop in 2 tablets as per requirement twice a day. Okay. So this is it. And if the mother is facing with some hypertension issues, morning sickness, acidity, pedal edema, anything, then it needs to be treated with doctor's guidance, of course. I won't be going into this because, as I've mentioned, I would be dealing with normal pregnancy as of now. If you want it, we can anyways have another session for this later on, some other day. Okay. Now this is very important. There are certain do's and don'ts you need to follow during pregnancy. Now, the very first thing is oil massage. As I said, Vata is dominant for the development of the baby. Wherever there is movement, there comes inclusion of Vata dosh. So to just keep this Vata well balanced or in control, we need to give a gentle oil massage, if possible, for the whole body. It shouldn't be a proper massage, but the oil should seep it into your skin. So it can be with plain coconut oil or any of the medicated oil like Bala oil, Shatavari oil, anything. But if you can't go for a whole body massage, important parts are your belly, then your breast and your thighs. Belly, because the baby is in the womb, it needs nourishment. And this applying oil, most importantly, keeps all the stretch marks away. If you practice application of oil, any oil, right from the day 1 of the pregnancy, you won't get a single stretch mark. Okay, that is the reason applying oil is important. Second thing, when you apply oil, you should apply oil on the breast. While applying oil on the breast, make sure, if you are planning for the first time, make sure to stretch your nipples out and give a gentle massage to your nipples. Because if you are pregnant for the first time, what happens is the breast starts developing, and whereas the nipple gets retracted inside. And after the labor, the child is not able to suck the milk properly. And what happens is, on the other hand, the milk is being produced, and if it is not well expressed out, it can lead to abscess formation in the breast. So it is very important from both mother and baby's point of view to apply oil on your breast and thighs, again for the stretch mark and for strengthening of the muscles. Then oil should be also applied on your head and at anus. Why at anus? Because many of the women, females, they suffer from constipation issues during pregnancy, and most of the times post pregnancy, that is after labor. And if what happens with hard stools, and the anal region gets also stiff and it gets hardened, and if the stools are also hard, it may lead to formation of piles or fissures at the anal region. And to avoid this and easy evacuation of stools, it is important to start applying oil at the anus right from the day 1. And meditation and yoga and whatever Garbha Sanskaar practice has been taught to you or you need to follow, you should follow it on a regular basis, at least 5 days a week. Because satatam dhyanam abhyasam, it is said that if you keep on doing it regularly, only then it is a practice, and only then it is going to benefit you and the baby. Then the don'ts is, as I mentioned, don't keep on hogging or food. You should only eat when you are hungry, and have any drinks, that is liquids, when you are thirsty. So avoid frequent munching, avoid smoking and alcohol completely when pregnant and before pregnancy. Okay, then avoid travel on, unless it is very important you can travel. Then avoid any adventurous things like rock climbing, traveling, or any rafting, anything like that. Avoid adventures, avoid any stress or disputes. If your hobbies are like watching movies, then make sure you don't watch too much of suspense or horror movies. And finally, avoid strenuous and excess exercise. Okay, now I think we are done with the antenatal phase. We'll move towards sutika phase, because as I mentioned, you may feel that why post labor is important in Garbha Sanskaar. Now, because the health doesn't stop, we cannot restrict the health of the baby and mother only after the childbirth. You need to take care of the baby and the mother even after the birth of the child. Because if you ignore the health at that level, your mother and child is not going to be healthy, would have any complications in their later life. And so following Sutika Paricharya, following Sutika and baby care is of utmost importance. Okay. Many of the elderly ladies in the family or our friends group, they usually coin this phase or delivery or the labor process as the rebirth of the woman, because the woman goes through such a turmoil. So it is called labor, and she has to go through a lot of pain, lot of exertion, and so it is coined as rebirth of a woman. And it is of a it is an important phase in any woman's life, because now after the child is born, also a new mother is born. And for a child to be healthy, mother's health is of utmost priority. Okay, so let us have a small, I'll just run through this Sutika phase fastly, because I won't take a lot of time with this. But what happens is, generally, if you see, during pregnancy, the uterus is well stretched to accommodate the baby. Now, after the labor, the uterus is vacated. Okay, and this vacated uterus doesn't immediately get back to its normal size, regain its normal size, posture, and tone. So what happens is, obviously, wherever there is an empty space, air gets filled into it. That is Vata. So this uterine cavity gets occupied with Vata dosh. And if this Vata dosh is left untreated at this stage, it can create a havoc. It can lead to Vata ailments in future, or also symptoms like abdominal pain, headache, or you can lose skin, lose belly, and you may not regain your shape and tone after pregnancy. So this Vata needs to be taken care of essentially. So what do we do in Sutika Paricharya? Now again, I'll repeat, Sutika Paricharya means code of conduct for the woman after delivery or after the labor. So the woman is termed as Sutika post-delivery, and Paricharya is code of behavioral and dietary conduct. So Sutika Paricharya. So what are the basic guideline about Sutika Paricharya is, when we think of Sutika Paricharya, it is about normalizing or balancing the vitiated Vata. It is about regaining strength and muscle tone of the uterus and the body, and also the shape of the uterus. It is about regaining uterine health and maintaining hormonal balance, getting back to hormonal balance. And the third important thing is to facilitate proper lactation for the baby, newborn baby. Now, how long should you follow the Sutika Paricharya? So woman is termed as Sutika for next 6 weeks after labor. So Sutika Paricharya should be followed for 6 weeks or 42 days. Okay. So as I told, what is the main aim for Sutika? So also the diet with Sutika goes accordingly to pacify Vata, to kindle the digestion, to aid digestion, to give an extra nourishment and strengthening to the baby, to the mother, to facilitate lactation, everything. Okay. So Sutika so the diet for the Sutika should be basically vata pacifying. So things which pacify vata are the things which are freshly cooked, warm food, easy to digest food. So you can have lots of soups, you can have freshly cooked food, anything, rice, roti, dal, chawal, anything. Don't hog on junk foods like fried foods, samosas, or fermented foods, because your responsibility after delivery, whatever you eat, is going to affect your child's health, because the child would be totally dependent on the breast milk. So whatever you eat during these days should be easy to digest. So this will prevent constipation and also aid digestion. Meals should be timely. So there are certain strengthening foods you should take. That is again milk, ghee, wheat or wheat preparations, semolina, dry dates, figs, then black currants, almonds. I have highlighted ghee over here because, as I said, ghee is very important to pacify vat, to strengthen the food, and also oleate or lubricate the body internally and externally. It also helps mental relaxation of the mother. It helps to bring the hormonal levels in the balance. So ghee is of utmost importance. Then there are certain foods which aid digestion and kindles digestion. It basically comprises of, you can add these as condiments like dry ginger, garlic. So you can prepare, whatever you're preparing, you can add just 2 cloves of garlic into your dosa or your pancakes or your khichdi or dal, whatever. You can temper it with garlic and dry ginger, that is sont. Okay. Again, pepper or black pepper is something which kindles digestion and also cleanses the uterus. So jaggery, instead of using crystal sugar, you can go for jaggery, turmeric, pipale, it is piper longum, or and pepper. This helps to cleanse the uterus. So it helps in proper uterine bleeding and eliminating all the toxins out of your body and cleanse your uterus. Only if your uterus is cleansed properly, it is able to regain its original shape, size, and muscular tone. And ultimately, it is going to help to maintain your health in near future. Okay, then certain things like dry coconut, moong, ghee, dry ginger, garlic, it also pacifies vat. Gum laddus or raisin laddus, it helps to regain uterine tone. Only thing is, if the delivery is LSCS labor, the cesarean section, then you can't have gum laddus for at least a month. Later on, you can have it. So it strengthens your back and also strengthens your uterine health. So if in case of absence of gum laddus, you can have porridges or laddus made with wheat flour, moong flour, or ragi flour. And to that, you can add seeds like garden cress seeds, methi seeds, ajwain seeds, anything. For detail, there are certain preparations, post-natal recipes I've mentioned in my blog, ayurvedalife.in, wherein you can find a list of recipes and how to make them for post-natal period and prenatal period also. You can check it on my blog or on my site, where you can in blog section. Okay, so there are other seeds like garden cress, ajwain, that is carom seeds, dill seeds, these and methika seeds, that is fenugreek seeds. These are again very good for uterine health. These act as hematinic, they are good for lactation, they cleanse the uterus and also maintain hormonal balance. One thing I forgot to mention is you can start on with dry dates and also fresh dates. You can soak these dates in ghee. These are really tasty and also very helpful for lactation and uterine health. Then whatever water you drink, make sure you have warm water throughout the day, because this again helps to control vat and keeps you away from indigestion, bloating, or headache symptoms, which are generally seen in postnatal period. So you can medicate the water with carom seeds, dill seeds, or salt, that is a pinch of a small piece of dry ginger. You just have to put this seeds into the water, boil the water for a few minutes, and then have it warm or hot. So, okay, I'll go to this. Okay. Sorry. Okay. Now you need to include certain medicines along with the diet postnatally for certain days. This is to just, again, as I said, to enhance lactation and pacify Vata and strengthen the mother. So and cleanse the uterus as well. So initially during first 10 days, it is advised that you have Dashamularishta or Balankada number 1, which is available in market for first 10 days. Then for the next 20 days, you can have plain Dashamul decoction, or again Dashamularishta in absence of Dashamul decoction, or Balankada number 2. Then there is a combination available in market known as Balan Battisa. You can have this 1/4 teaspoon twice a day with ghee. In absence of Balan Battisa, you can have 1/4 teaspoon of dry ginger powder mixed with jaggery and have it with ghee twice a day. This will also act in a similar fashion. Then Shatavari Kalpa will boost the lactation, so you can have it with milk twice a day, and comes as again Shunthi, that is dry ginger, and peppery churn. Okay, where did I go? Okay. Then after the dietary things, there are certain practices which should be taken care of for the new mother. So first, most important thing is you have to maintain strict hygiene, like cleaning the floor, not allowing to take anybody coming in directly to the room, or taking the child in the hand. You should make sure that the hands are well sanitized, and then they enter the room. Fumigate the room with dhoop, vacha is sweet black, gugul, ajwain, and neem. So what usually we do is we just take a fumigating, you just burn a coal, and after the coal is red hot, you can add a pinch of dhoop, vacha, gugul, ajwain on it, and you can just spread the smoke throughout the room, around the clothes, baby's clothes or the mother's clothes. So this will keep the infections away, and also keep maintain hygiene in the room, and also keep all the doshas in balance. Okay, bodily doshas. Another thing is avoid air conditioners or coolers or direct fan or direct wind. Make sure you are well covered. You cover your head with a scarf, or you keep yourself warm. And again, to keep the Vata in control, as gentle oil massage was recommended in prenatal phase. Similarly, a gentle body massage with medicated oil, Shatavari oil, Bala oil, Dhanvantar oil, or any plain sesame oil. You have to compulsory undergo a complete body massage. I repeat, a whole body massage postnatally for next 6 weeks. This is the most important practice, because this takes care of you and the Vata dosh throughout your life. If you miss this thing during Sutika period or Sutika phase, you're bound to have some or the other ailments in the future. Okay. Then after the massage, you should take bath with warm water or hot water. If possible, try to foment your bag, because your bag undergoes a lot of strain during labor. You need to take care of it. You can apply steam, or you can just pour on hot water during your bath. Then vaginal fumigation. As you fumigate the house, what we have here what practice we follow over here is the coal is placed in a vessel, a fumigating vessel, and a sieve is placed upwards down on it, and whatever fumes come out are taken as the woman sits on this in a squatting position and places under the legs. So, or whatever smoke comes out reaches the vaginal area. So why smoke? Because if you observe keenly, smoke has a tendency to penetrate in the deepest corners. So whatever you can foment your hand or body from outside, but you can't do it with the vaginal area or the uterus. So these smoke, when it infumes, when it enters the vaginal area, it not only pacifies the vata over there, but also relieves the pain or disinfects the vaginal area. Okay, and it's of utmost importance to keep this vaginal area clean and dry to prevent any postnatal complications. Another important thing is use well-supported braziers to avoid breast sagging. Then belly binding practice is of utmost important. It not only gives gives support to your back, but also helps to bring back your tummy into shape and pacifies Vata. Take care of Vata throughout the body. So what you have to do is, you either get belly binding belts, you apply it on your tummy, or you can take a long sari or long cotton cloth, fold it into a style of belt, and make sure you cover complete whole of your tummy from the upper end, from the epigastric area to the lower abdomen, and tie this belt tightly around your waist. Make sure you leave this belt for at least 4 to 5 hours every day for next 6 weeks. Okay. Then, as I said, cover your heads and ear properly. You can just plug in small cotton plugs into your ears. Eat fresh food, freshly cooked homemade food. Don't even also try to have cold, refrigerated, stale food. Okay. Then for medicated water, you can medicate your water with dry ginger, ajwain, and soft, that is dill seeds and carom seeds. Important thing, you are at home and taking care of the baby, but you have many incoming calls for congratulating messages, or you have spare time, so people keep on calling you just to comfort you. But excessive talking, laughing, exertion, or stress may aggravate Vata. And you have to, as I mentioned initially, you have to keep this Vata well balanced and not let it vitiate or aggravate. So avoid excessive talking, laughing, or exertion. I finish with the Sutika Paricharya. Then comes the baby care. Baby care, again, strict hygiene is important. Timely breastfeeding. Your doctor, as usual, guides you when you go back to home after the hospital, like from the hospital. Sorry. So your doctor guides you well about breastfeeding. Post feeding, make sure you you make your child baby birth. So you just have to place your baby on the back, on your shoulder, and pat 2-3 times on the back. So the baby burps. And otherwise, if you don't practice this post-feed burping, what happens is the child may have a tendency to vomit it up. Again, as oil massage is important for the mother, similarly, the baby undergoes a strenuous process for during the labor, and bath is also aggravated in the baby. So the child also needs a regular oil massage. Then oil application on head and belly is of utmost important. Application of oil on belly, that is navel, helps relieve the flatus and gases. And application, if you see the head bones, whatever the bones on the skull are not unified during pregnancy, to facilitate easy expulsion of the baby. So in order to bind it well or to fuse it properly, you need to apply oil on the head as well. Head in the sense on top of the head. Then fumigation with ajwain. You can just similarly, as I mentioned during the Sutika Paricharya, you can just burn a coal, light a coal, and add a pinch of ajwain and vinegar and vacha, sweet flag, and place it in the corner of the room. And then the fumes may accommodate the room and help the baby. Fumigation of baby and oil massage should be done by a trained person, or you can learn it how to fumigate and train oil massage the baby. Application of pinch of vacha powder on chest and back of the baby is very essential, because this again keeps the baby away from infection. Second thing, important thing, is the baby tends to have to be dominant with kapha dosh. So to prevent kapha ailments like cough, cold, anything, you need to apply just dry application of vacha on the chest and back. The baby should take adequate rest, and the important thing is Balaguti and Suvarnaprashan. Now, Balaguti is combination of certain herbs. You get a combination of some 16 to 20 herbs, which you can use as per required for the baby's growth. But there are certain herbs which you can give on a I'm sorry, which you can give on a regular basis. So there's a small stone for rubbing, which is generally used in for puja or to rub chandan, that is sandal. So you can buy the smaller one and soak it, immerse it in water for 2 days, keep changing the water, and then with as per the child grows, every month you can just rub a small circle of this herb, and sorry, I'll repeat, you just have to put few drops of breast milk on that stone, and rub each herb on that stone in a circular fashion for once. As the child enters the second month, you have to make 2 rounds of that herb, and so on till the child turns of 1 year. You can also rub a pure 24 karat gold coin, and to that you can add honey and ghee. So one more thing, what does Balaguti does? It helps in teething, better health and immunity of the child, and proper growth. This you can do, you can just at the time of birth, once the baby is born and settle down, you can just rub a single round of gold and honey and ghee and make the baby lick. This is an auspicious thing which we follow here in Ayurveda. And the last but not the least is the Suvarnaprashan. Suvarnaprashan is one of the 16 essential rituals described in Ayurveda. Suvarnaprashan is literally giving gold to the baby in the form of ash, or you just rub it on the stone, as I mentioned previously. Now, gold has the quality to, it is a good mental tonic, it is an immunity booster, it helps proper physical and mental growth of the individual. So the importance, so instead of giving it alone, you need a base. So we give a medicated ghee along with honey and give it to the child as per the age of the child. So Suvarnaprashan increases immunity power, it improves stamina and physical health in children. It improves child's intellect, grasping power, sharpness, analysis power, and in some children it also increases digestion, improves digestion. So it protects the child during teething phase, especially the child succumbs to many health conditions during teething phase, and so Suvarnaprashan proves very beneficial if taken right from the first month of pregnancy. So these are the things you can do for the baby care. So what are the here I end the session. Thank you. But what would be the key points? So key points is you should plan the pregnancy well in advance and follow detoxification process. If you're already pregnant, then start with Garbha Sanskaar practices, that is communicating with the womb, communicating with the bum, meditating, practicing simple spiritual things, or following your hobbies, just to calm you down, relax, and follow the practices which are mentioned in Sutika phase and also prenatal phase. Okay, so all this would really help you to have a healthy, happy motherhood. I wish you all a very happy motherhood. If you want to know anything more about the same topic, you can always contact me on my given number, or drop a mail on my email ID. For more details, you can find some blogs written on my blog page, ayurvedalive.in. I have written few blogs about prenatal care, antenatal care, postnatal care, and few recipes for the new mother. So you can go through it. Feel free to ask any queries or contact me anytime if you want. Lastly, I'll thank hellomyyoga and the team to give me an opportunity to share this knowledge with all of you. Thank you.
Thank you, Dr. Shweta.
Thank you.
It was really an insightful session. I request all the participants, we are open for the question answers. So if you have any doubts or any questions, please feel free to ask. Dr. Shweta, we can stop the screen share.
Yeah. Yeah. Okay, so I have a question over here for any dairy replacements for vegans. So I think soy milk would help you in that case. Soy milk is a good source of proteins, and whatever milk, yeah, whatever protein, like nutrients milk provides, can be replaced with soy milk, almond milk to some extent, or coconut milk can also help.
Thank you, Dr. Shweta.
Okay.
For an insightful session. And your session was actually a capsule knowledge based on Ahar, Achar, Vichar, and Vyavhar for all the mothers out there. So we are really honored to have you, host you for this Mother's Day. We have one more question coming in from Subhra Kundu. She's asking how to prepare buttermilk.
Okay. So there's one more question. I'll get back to it later. But how to prepare buttermilk? So first of all, you have to settle with curd. So you have to prepare a fresh curd. So how you do it? You simply take a curd culture or a small amount of curd and spread it evenly in your glass bowl, and then add lukewarm milk to it, into that bowl, and leave it overnight. The curd sets in by the next day. Then you once the curd is well set, then you add 4 times water to the curd and churn it well for around 5-10 minutes, so you get a thin buttermilk. So you can have a glass of buttermilk with your lunch, not dinner. Okay. And you can add coriander seed powder, you can add dry ginger powder or cumin powder to it to make it tasty. You can also add a pinch of rock salt to it, so it helps you in digestion and also relieves flatulence, constipation in pregnancy. Okay, is it clear? Okay, there's one more question on my side. What is the reason most of the cesarean delivered women can't get their stomach back in shape and usually is saggy for years beyond doing yoga and walking? I think, Pranjali, I have answered this. I have mentioned that once the uterus is vacated, there's a lot of Vata dosh entering the uterus, and it is advisable. That is the reason it is recommended for belly binding. You bind the belly from the day one. So to just keep this, you don't have to keep the uterus inflated or saggy. You just have to compress it with the belly binding. So what happens is there is no space for air to enter into it. And this cannot be done in cesarean section because of the stitches and the wound to heal. We have to spare some time for the wound healing. So I usually recommend, if not immediately after, so I think it takes 3 weeks for the wound to heal completely. Post that, you can start applying oil, you can start belly massage and belly binding. This is the reason there's a problem the cesarean section. After cesarean section, there is a lot of sagging of the belly. But what you can do is, as I mentioned, okay, you can't bind the belly, but you can give a good amount of Vata pacifying foods. So you have to be very strict on Vata pacifying uterine strengthening diet to prevent this belly from sagging. Okay. Okay.
Ma'am,
yes.
In the same line, as you were telling, talking about some foods which can be taken after delivery. So you just mentioned that gum laddus to be avoided for C-section. So other things can be taken, right?
Other things can be taken. See, what happens is gum is usually hot in potency, but what happens, it sometimes it happens due to that hot potency, it does not allow wound healing properly. So we are asked not to have gugul, that is, sorry, dinka laddus. What you can do is, instead of making a dinka laddu, you can add this badan battisa powder or sont powder and all these methi seeds, fenugreek seeds, or garden cress seeds, ajwain seeds, and make this wheat flour laddus or ragi laddus or moong laddus. Or you can make combination of all these three flours and make a single laddu. You can also have garden cress, that is harif ka kheer, that is porridge with a lot of ghee, or you can make pancakes out of it. So you can have a lot of dates. So these all will pacify vat, even if you can't bind the belly well or give a oil.
By gum we mean gond, which we say.
Gond, yes, dink.
Yeah. Dink. Okay. Yeah, so just that need to be avoided. Others can be taken.
Yes. 21 days. Otherwise, you can add poppy seeds also. That is khaskhas. That is good for lactation. Okay. Up till what age pregnancy can be recommended? I have a question from Vasundhara. Am I audible? Hello?
Yes, Dr. Shweta, you are audible.
So usually if we consider what we consider in Ayurveda or in Indian science, everything is utpatti, sthiti and lay. That is, everything which is born goes into a development phase for a certain age, then it attains a stability in younger age for a certain period, and then it goes to demolishing stage. It is as with nature, is same as with the body. So usually periods, menstrual cycle sets in at the age of 11, 12 on an average. Now it has come up early as well, but usually it sets in that age, and there's a menopause at the age of 45 to 50. So even if we consider from 12 to 45, it becomes 33 years. So if you divide this 33 years into 3 parts, it comes up to, so ideal the pregnancy age should be till 35. No doubt there are cases where we see pregnancy at the age of 40 also, but that can be done. But the ideal age, if you say, it should range somewhere from 21 to 33. Okay. Any more questions?
I think we are done with the question answer session. Thank you so much, Dr. Shweta.
Thank you. I once again thank hellomyyoga and the team for giving me the opportunity to share this.
Hello, ma'am. Ma'am, if ghee is not suit, then what type of is intake?
Okay, so not if ghee doesn't suit. This is very rare case that ghee doesn't suit. It is about the taste. People don't like ghee, and so they say it doesn't suit. So if it is the case, you can use this ghee into preparation, or just simply have a teaspoon of ghee and drink a hot water. Take a sip of hot water or any drink with it. If there is a problem with ghee, you can go for with milk. You can go with buttermilk, or you can go with fresh butter, makhan jisko bolte hain. You can indulge into these things. And if all this is not possible, you can go for a teaspoon of coconut oil. But it should be virgin coconut oil, of course.